Well, how important is it for hunters and landowners to understand the management of the game species and the non-game species they enjoy in this country? I think it's vital, and it's an issue that needs work, and can, as a state wildlife agency, or just concerned hunters or partakers in those wildlife resources, we have to continue to try to educate ourselves and continue to educate all of the stakeholders within the United States to make sure that we maintain that level of buy-in, essentially, to wildlife and their issues.
We have a responsibility to be informed about chronic wasting disease. We have a responsibility to know how to change our behavior as hunters. We have a responsibility to ourselves and our families to make informed and intelligent decisions. We also have a responsibility to future generations of hunters. We have a responsibility to pass on this hunting tradition.
So I think the best we can hope for is to limit the distribution to where it is today, decrease the prevalence, keep the rate of turnover in these deer populations and elk populations high enough that that prevalence doesn't increase and ideally would decrease over time.
Risk of complacency with CWD would be that it is a disease that would have serious long-term impacts on our wildlife populations, and it would have spread to a point beyond which we could control it or do anything to turn the disease around. That is probably a concern that we all have, is by essentially monitoring this disease, are we allowing it to spread to the point that we can't do anything about it?
I think the approach that the Wisconsin DNR is using today is a wise one. It's methodical, they're learning as they go. And I do think, based on what we know today, absent vaccines and other tools that could help manage the disease, that reducing deer densities in areas where the disease exists and monitoring extensively outside of those areas to detect any new foci of infection and trying to deal with those is about the most strategic way to go about management.
But I think the future holds promise. There's a tremendous amount of work being done on these diseases, and I think it will have applicability and benefit to wildlife populations.